Rural parts of the country are being hit especially hard right now by the virus. Rural Americans dying from COVID at more than twice the rate of their urban counterparts. NewsNation correspondent Marky Martin live for us tonight in Mount Pleasant, Texas. It's a population of about 16,000. So, Marky, we're looking, what's behind the surging numbers in more remote areas?
Yeah, just a quick correction, Nicole. We are in Dallas this afternoon, but it's multifactorial. There are several different reasons why those rural communities are struggling so badly with those COVID death rates. To put it bluntly, if you think about the demographics there, they're usually poorer, sicker, heavier, not the access to quality health care that you have in some of these metropolitan cities like Dallas. But perhaps at the forefront of the issue, those hospitals are simply overrun and understaffed.
There are a lot of barriers that limit rural residents from accessing health care.
Lower vaccination rates and less access to health care, a recipe for disaster in rural America.
We are seeing, unfortunately, that wave, this kind of fourth wave affecting our rural hospitals to the point where we're being stretched very, very thin.
As hospitals nationwide fill up, there's less availability for the sickest patients in small communities to find care. It's the same story from Texas to Mississippi.
We had over 20 folks waiting to be transferred into Austin Travis County for care.
The challenge that we face is most of all of the higher level facilities that we transfer patients to are they're maxed out.
According to data from the Rural Policy Research Institute, when COVID first burst on the scene, it was an overwhelmingly urban problem. The next two waves affected both cities and small towns. But in August, COVID death rates skyrocketed outside of major metropolitan areas. And now rural Americans are dying at twice the rate of urban residents. It's a problem rural hospital officials say won't improve anytime soon.
How much longer can we keep doing this? Because it's taking a very heavy toll on the people that have to do the work on the front line of taking care of people.
And Nicole, another thing to think about, in urban cities like here in Dallas or you in Chicago, we are about 5 minutes away from that next testing site or a vaccine. In some of these smaller towns, the entire county might have one place that you can get tested. Vaccines likely not as readily available. And also, just to be straightforward, what we're hearing from a lot of communities, there are a lot of people that aren't willing to put in the work or even take the time off to travel to one of these larger metropolitan cities to get the COVID care that they need. Nicole.
Oh, yeah, Marky, access makes a big, big difference. All right, Marky, thank you for that.